Hi everyone, Dr. Priyadat Patel, your friendly gynecologist from Balaji Horizon Women's Hospital, Ahmedabad. So again, for the discussing the my one of the most favorite topic as far as gynecology is concerned is endometriosis. The common question which is occurring in people's mind or patient's mind is कि ये बारी बारी क्यों होता है? Why there is a recurrence as far as endometriosis is concerned? In our last video, we have discussed that endometriosis is very nowadays commonly seen, particularly in urban population, which is more common. We don't know why, but we are seeing it very routinely. वो क्यों होता है उसका रीजन सबको नहीं पता है. Scientifically also it cannot be pinpointed down. As we have already discussed, there are a lot of theories through which endometriosis can occur in a particular patient, but there are well documentation which are there that the growth of the endometriosis is majority depend on hormones, particularly estrogen hormones. The rate of the growth may vary from person to person as far as reproductive age group is concerned, but majority it depends on estrogen hormone. So till the female or a woman is menstruating, indirectly it suggests she is having a plenty of hormones inside her body through ovary, particularly estrogen hormone, because only through estrogen hormone the endometrium generally forms, the endometriosis grows. और उसी की वजह से whenever we intervene in any patient of endometriosis, small micro implants which we are not able to see in sonography or in laparoscopy may regrow over a period of time. As far as intervention is concerned, broadly it is related to the symptomatology and पेशेंट को क्या दिक्कत आ रही है, कौन से प्रॉब्लम है, किस तरह प्रॉब्लम हो रहा है, उसके ऊपर डिपेंड कर रहा है. बट जनरली एज फार एज सर्जिकल पॉइंट ऑफ व्यू वी डिवाइड एंडोमेट्रियोसिस इनटू 3 कैटेगरी. One is endometrioma, that is chocolate cyst or ovarian endometriosis. And the second broad category is extra ovarian endometriosis, and that is divided into two parts. One is peritoneal or surface endometriosis, and the second part is deep infiltrating endometriosis. So whenever the endometriosis affects the internal lining of the abdomen, जो हम लोग लेमन में बोलते हैं कि पेट की अंदर की दीवार वो अफेक्ट होती है, तो उसको पेरिटोनियल एंडोमेट्रियोसिस या सरफेस एंडोमेट्रियोसिस बोलते हैं. एंड जब ये एंडोमेट्रियोसिस मोर देन 5 mm इनसाइड द पेरिटोनियल लाइनिंग पेनिट्रेट करता है और एक तरह का नोड्यूल फॉर्म करता है, तो उसको डीप इन्फिल्ट्रेटिंग एंडोमेट्रियोसिस बोलते हैं. सो व्हेन द पेशेंट रिक्वायर्स इंटरवेंशन, सर्जिकल इंटरवेंशन, तो उसमें एक चीज़ हमेशा ध्यान रखनी है, without doing any harm to the existing structure of the patient, you have to exercise as much as possible. जितना एक्सरसाइज कंप्लीट होगा एंडोमेट्रियोसिस का, उतना चांसेस ऑफ रिकरेंस वुड बी लेस. दो रिकरेंस के बीच में टाइम भी ज़्यादा मिलेगा, और जो हमारा टारगेटेड आउटकम है, जैसे पेन है पेशेंट को और उसके लिए सर्जरी कर रहे हैं, या फर्टिलिटी या प्रेगनेंसी है और उसके लिए सर्जरी कर रहे हैं, we can achieve the maximum possible outcome. So when patient goes for a surgery for a endometriosis, only ovarian endometriosis clear करना या chocolate cyst remove करना या ovary में से cystectomy करके you just end the surgery. If the person is not fully confident or trained in doing endometriosis surgery, it is okay. But if it is good as far as patient's outcome is concerned, that you have to clear everything, including extra ovarian endometriosis, that is surface endometriosis and deep infiltrating endometriosis, the nodule situated wherever inside the abdominal cavity. एंड ये जो पर्टिकुलरली डीप इन्फिल्ट्रेटिंग एंडोमेट्रियोसिस डिसीज है वो काफ़ी नोटोरियस होता है. इट जनरली इन्वॉल्व्स द पेल्विक ऑर्गन सराउंडिंग द यूट्रस, पर्टिकुलरली जो अपना इंटेस्टिन बोलते हैं, रेक्टम एंड सिग्मोइड कॉलोन, पैरामेट्रियम बोलते हैं जो यूट्रस के बाजू का फैट टिश्यू होता है जहाँ से यूरेटर एंड वेसल्स पास होती है, तो यूरेट्रिक इन्वॉल्वमेंट होने की पॉसिबिलिटी रहती है जो यूरिन किडनी में से ब्लेडर में ले जाता है. और अगर ये डिसीज़ वहाँ पर रख के हम लोग बाहर आ जाते हैं ड्यूरिंग द टाइम ऑफ सर्जरी, तो चांसेस ऑफ रिकरेंस वुड बी कंपैरेटिवली हाई, और ऐसा वेरी लेस लाइकली कि पेशेंट को सिम्टोमेटिक रिलीफ हो, क्योंकि पेन माइट बी परसिस्टेंट because DIE, deep infiltrating endometriosis, and surface endometriosis are very notorious as far as pain is concerned. And to a certain extent, fertility point of view भी दिक्कत आ सकती है. So, kind of endometriosis surgery is going to be a very tricky surgery. It requires an expert hand. It varies from patient to patient. Same finding, same sonography, same situation, same extent of a disease, but if patient has a fertility issue, the approach would be different. And if the patient has a pain as a primary complaint or a primary symptom, the approach would be different. So it is always going to be a tailor-made approach as far as endometriosis is concerned. ગુજરાતી में बहुत एक common કહેવત है कि મને જેટલું જોઈએ ને એટલું હું લઈ લઉં. The same thing is applicable as far as endometriosis is concerned. The ultimate aim is to clear the desirable outcome of the patient. That is what very important. And the another most important thing is what not to do in cases of endometriosis. That is also very important. In our next video, we will discuss in detail regarding the ovarian endometriosis or a chocolate cyst and extra ovarian endometriosis, that is the surface endometriosis and deep infiltrating endometriosis in a great detail, and the outcome of each and every types of endometriosis in that videos. So if you have any queries regarding the same, you can contact us, you can leave in the comment, or you can consult your family physician. Thank you so much. See you soon. Once again, your friendly gynecologist Dr. Priyadat Patel from Balaji Horizon Women's Hospital, Ahmedabad.